I write because our TriMet union members are deeply upset by our station's recent coverage concerning our health benefits. The information coming from the Golden Fleece Group is grossly misleading and puts TriMet employees in a false light by asserting that TriMet pays $1,937 per month per employee for health insurance. TriMet recently conducted a benefit survey that compared its insurance costs to state and local governments. It then presented the results of that survey to the Oregon legislature in the form of written testimony. An excerpt of that testimony states the following. The cost of TriMet's PPO is 4% to 29% lower than the state of Oregon's. The cost of TriMet's HMO plan is 15 to 38% lower for a single employee than the state of Oregon's. The cost of TriMet's PPO plan for single employees is less than both the city of Portland and the state plans. Employee-only HMO costs are less than the state plans. It is only in family coverage, employee, spouse, and children, costs that TriMet coverage exceeds that of the state. That cost is $1,288 per month. TriMet retirees do not have PERS pensions. Many retired 20-year employees have pensions as low as $600 per month. Rather than receiving pensions comparable to other state and local governments, these workers elect to receive supplemental health insurance benefits. TriMet's cost for retiree health insurance is far less than the lowest amounts paid for an active employee, since retiree insurance is supplemented by Medicare. Lastly, many people think that operating a bus is a physically easy job. It is not. A workforce that is sicker is more costly. Attached is a fact sheet detailing the physical toll public transportation takes on bus operators. A survey of death certificates of TriMet operators confirms the accuracy of the statements in the fact sheet, which were taken from studies filled with the National Institutes of Health. A copy of the studies digest is available. Another falsity being promoted in the broadcast media concerns plastic surgery and health club memberships. TriMet employees do not get free plastic surgery, except that which is medically necessary, such as breast reduction because of debilitating spinal problems. Additionally, health club access by employees is limited to on-site rooms containing a few pieces of equipment that the employees have to pay to use. We ask that your station present some of the above alternative information. The group that put forth the false and misleading information is well known to be advancing a specific political agenda. We also ask that in the future their information be confirmed independently, and that an effort be made to present a balanced discussion of the issues they raise prior to broadcasting their viewpoint. Thank you for your time and attention to this request. Just one example. In a 10-hour workday, the Route 20 bus operator travels at least 210 miles. At least 2 of those hours entail driving during peak rush hour traffic. During this 10-hour day, the bus operator pulls into traffic approximately 251 times from a curbside stop. At the same time, he is interacting with approximately 1,840 passengers, checking fare amounts, punching transfers, loading bicycles, lowering the lift, tying down wheelchairs, and being especially careful with the unstable and the elderly. He also is answering questions for about 20 pedestrian non-passengers. The Route 20 bus operator is also required to make 216 ADA call-outs each day. This in addition to also remembering to make approximately 20 non-scheduled, non-ADA call-outs. The consequences of this sort of activity: 1. Bus operators get sick more often, get disabled younger, and die at an earlier age than the general population. 2. Bus operators experience heart disease and hypertension at much higher rates than the general population. 3. Bus operators are twice as likely to commit suicide as the general population. 4. Bus operators are more likely to die from leukemia, lung, stomach, rectal, prostate, bladder, and kidney cancers than the general population. 5. 68% of bus operators experience back injuries and degenerative disorders due to constant whole body vibrations, turning the bus to the left, turning the bus to the right to address passengers. 6. Bus operators have higher rates of diabetes and obesity than the general population, even though studies show they exercise at a greater rate than do other occupations. There is a direct correlation between constant whole body vibration and diabetes and obesity.
When the union's inspiration through the workers' blood shall run, there can be no power greater anywhere beneath the sun. Yet what force on earth is weaker than the feeble strength of one? But the union makes us strong.